Good morning, good afternoon, good evening, everyone, depending on where we are. My name is Nyasha Sithole. I will be the host for today for this session 4, where we'll be talking about establishing more inclusive service level agreements for genomic sequencing equipment in Africa. This is the 4th session in monthly series that we've been having for this community of practice for supply chain. So this is the rundown of how things are going to be happening. We are already having the welcome remarks here. We are going to have a brief introductory slides from one of our team members here. Then we'll have the advocacy points for action genomic sequencing, a presentation from AfCDC. Then we'll have the overview, the main presentation, the overview of inclusive service level agreements from Julia. Then after that, we are going to have an open discussion as feedback from the presentations that we would have received. And of course, as usual, we will discuss the next steps before the closing remarks about how we think we should proceed based on what we would have received. So I will hand over this time to Dr. Silva Mashate to give us the opening presentation about the rationale for prioritizing this. Mashate, you can go ahead. I will be moving the slides for you. Over to you.
Thank you so much, Nyasha and colleagues. We appreciate and thank you for sparing your time to join us in this session. And like the preamble has been put forward by Nyasha, we are in this session discussing the rationale of prioritizing the service level agreements. We know that the procurement and availability of these genomic sequencing equipment and associated communities has been very complex. And from the previous discussions, if Nyasha you could flag the next slide, is that a couple of challenges were profiled, and one of them actually is in line with what we are discussing today. So previously, these are the key, if you look on the left of our slide that you are seeing right now, those are the 5 key broad challenges that we identified by AfCDC together in collaboration with the partners across different countries, where we have issues to do with the high cost of the commodities, limited market forecast availability, there is no adequate data to do all that. And then the issue to do with the service level agreements, and then the lengthy processes for procurement, and then insufficient in-country skills and capabilities for the procurement and supply chain. But in this session, we are focusing on that 3rd challenge, which is to do with the service level agreements. And from what we experience in our different countries and different levels of service or provision that we do have, we notice that this is an area which is really fragmented. Quite often we notice there is inadequate transparency and standardization of these processes. You discover that you could have one manufacturer or one supplier of a particular device or equipment, but the processes of the service agreements vary across, and this makes it very difficult. And this comes with negative effects, where we at times end up with unforeseen costs, because at times stakeholders sign contracts and then realize there are issues of maybe servicing, maybe call-ins for the technicians who look at these machines. And this results in prolonged downtime of the equipment. And this is, of course, affects our public health responses in terms of diagnostics, surveillance, and research. And therefore, this session is here today to help us share some of the experiences, get guidance from many of you, share experiences on how we can explore processes and modalities of standardizing these terms for the service level agreements. And this should be in a way that it helps us to move forward and improve, remembering that this is not the only challenge. There are others. For the purpose of this session, we're only focusing on actually this one. Thank you. And Nyasha, if you could go to the next slide. And I think this background gives us a good step now for us to proceed. And I will hand over to Nyasha to welcome AfCDC to give us their inputs on this discussion. Thank you so much, and over to you, Nyasha.
Thank you very much, Sir. At this moment in time, we are going to have a presentation from AfCDC, and this is going to be given by none other than Dr. Sophonius Tesema, who is the program lead for pathogen genomics at the AfCDC. Dr. Sophonius, do you want to share the slides from your side, or I can do it from here? We are comfortable any of the options.
Thank you, Nyasha. I think you can do it from your end, if that's okay.
Thank you, sir.
Good afternoon, good morning, colleagues. My name is Sophonius. I work at the AfCDC. I lead the pathogen genomics program. I'll take you through some of the work that's been done and some of the solutions that we've been collectively thinking about with our partners, FIND, CHAI, the Gates Foundation, and others. If you go to the next slide. Next. Yeah, so before I go into the solutions, we are seeing an opportunity here. There is an ever-increasing access to genomic sequencing products in the continent. We have recorded an unprecedented growth of genomics capacity, both in terms of numbers and geographic expansion in the continent. For example, from 2019 to 2025, there is a significant increase in the number of national reference labs that have local sequencing capability, which increased from 7 to 46 within a span of 5 years. We are also encouraged by the breakthroughs and innovations in sequencing, which we think is an accelerator for further expansion of sequencing in Africa and specifically in the public health space, which is leading to reduction in the cost of sequencing, and then also alternative models and types of sequencing are being emerging. With all these opportunities, we are facing a significant challenge, which I will not talk a lot about it. Next slide. We have challenge, and we think supply chain is one of the weakest link in our effort to expand genomics capacity in the continent, and it requires collective actions to address this challenge. I think Sylvester already mentioned it, the delays, the lengthy processes, the lack of optimization in supply chain has been really a challenge for specifically for public health and then also for research institutions. This is also leading to very high cost of very high cost per sequence when we compare the cost of sequencing in Africa with the other parts of the world. There are progresses to address this challenge, and we are seeing very encouraging steps being taken. As AfCDC, we've also been trying to be part of these proposed solutions. And then there are some efforts that we are taking as a solution for some of the challenges that we are observing in Africa. One of them being today's topic, which is the service level agreements. Next slide. So there's been a bit of thinking around the solution, and this community of practice is also part of that, coming up with a solution. There are different problems that we hear in every daily basis from different types of customers within the continent, service providers, the private sector. We have a lot of challenge that we can hear. But in the past year or so, there was a discussion with our partners, CHAI, FIND, and the Gates Foundation to think about specific solutions. Next slide, please. Although all solutions may not be happen overnight, from Dr. Sylvester's slides, you've seen the key challenge that were identified. What we are encouraged about. So at AfCDC, one of the areas that we have identified as a gap together with the partners is the prioritization of this challenge, the understanding of the challenge, and the need to act and the urgency that's required on the actions is something that was identified. And we are advocating for member states, national and research laboratories, institutions that are doing sequencing, partners, and all stakeholders to recognize the challenge around the supply chain and procurement, but also to act. If you go to the next slide, we have come up with some recommendations for the different actors. The first one is for member states. One of the challenges that we are facing and we are hearing, and assessments have also identified it, is the customs and duty processes for genomic sequencing products takes significantly longer time, which affects the utility of this technology for public health outbreak detection and surveillance. So we, as AfCDC, recommend member states to expedite this process. It varies between countries to countries, but for countries to expedite this process so that the genomic sequencing products can actually be in the labs at a reasonable time. Simplifying the processes that can reduce the lead time. There are multiple processes, multiple approval levels that requires more time. So we also strongly recommend for member states to reduce these lead times so that we can reduce the challenge of stockouts and the cost of sequencing. We are also calling for member states to prioritize, to collaborate and align what they are doing at the national level with the efforts that are currently being conducted at regional and global levels. Specifically for national public health institutions, national reference laboratories, we are also recommending for continued follow-up. Sometimes because of a repeated challenge, it might look difficult, but as I showed earlier, we can take step-by-step actions to address some of the challenges. To also document the challenge. Sometimes it's very difficult. There are more opinion-based rather than fact and data-based description of the challenge that we've heard in the past. For the accountability that was presented earlier, we need to have the documentation and then also communicating this challenge so that all levels are accountable to the promises, and then also to make sure that these challenges are documented and addressed. We are also calling for public health institutions, laboratories, research institutions, academic institutions to support this continental community of practice. For example, participating in this survey, participating in the subgroups, it's really critical. This will take a village, this will take a community to address it. That's why this community of practice was established. So please actively involve and support this community of practice to address the challenge. With manufacturers, we've been collaborating very closely with manufacturers. We acknowledge the manufacturers are taking steps, but as they take more steps in accessibility and expansion of this capacity in Africa, there are also emerging challenges, such as the SLA, the technical support that is needed, the distribution and the turnaround time. All of that is also becoming a challenge. So we call for manufacturers to be more transparent and to support the work that's being done by CHAI and other partners to address this challenge. We also call for manufacturers to invest on innovations that can ease some of the PSCM challenges, such as cold chain and then also bundling products to reduce some of the challenges that we are facing as a continent. Next slide, please. Coming back to more specific, next one, please. Coming back to more on the development, adoption, and implementation of this required minimum service level agreement, I will not repeat what was presented, but I will just be show very high level points. Next slide. The current draft of the required minimum service level agreement highlights. Next slide, please. Okay, so there are several that we always identify when we work with the countries, including the shipping and other related components of spare parts. The other biggest challenge for us and from a public health perspective is the time. How long does it take for a machine to be maintained, especially when the machine is down? That's, to be honest, it's very unacceptable at the moment. So this would require a more targeted, more ambitious, and more practical solution. The details were shared earlier. For example, getting a response within 24 hours. I don't think this is a big ask. Providing support within 48 hours. We know what these sequencing companies can do in the other parts of the world, so it's doable. And we think and we call for these manufacturers to also do the same for Africa. There is also an issue of transparency, as you saw from earlier presentation. Some of it, even the cost cannot be seen on the website. So again, increasing transparency is also very important, so that there is a more transparent approach to address this problem. Not only developing the minimum service level agreement, but also the plan for AfCDC. Next slide, please. Is also, as it was said, there was a clear roadmap that was presented by Chai. Next slide, please. If you go back. Yeah, so there are steps that were identified, the consultation of these steps that needs to be taken. I think this community of practice is an opportunity for all of you to be part of it and refine what's being proposed. All stakeholders, both the private sector, the users are welcome, and we can make it better by having this kind of consultation. We would also like for all of you to help with the donation of this information. And then after that, there is a plan to implement it in a stepwise way, and then also to monitor and evaluate the progress. At the moment, if I say it in short, the current service level agreement that we have in Africa for sequencing equipment is too expensive and it's not working. We need a solution, and this solution will require this collective action from all stakeholders in the space. So to do so, if you go to next slide, please complete the survey that was shared on the chat box by Chai. But we are also very much welcome any ideas in improving these issues. Any feedbacks are welcome. You can email us on the contact that's indicated here. All ideas, all feedbacks, all solutions are welcome. Thank you very much for the opportunity to present. Over to you, Chair.
Thank you very much, Dr. Sophonius.
Julia, are you ready to step in? We could go to your presentation. We can always allow Dr. Sophonius to.
Sure, I'm ready. Can you see my slides?
Yes, we can see. Thank you.
Okay, everyone, nice to meet you. My name is Julia Tuttle, and I work for CHI, the Clinton Health Access Initiative. So first of all, we've shared a pre-survey in the chat box. So please, if you can manage to fill that out, we'd be very interested in your feedback. Otherwise, in terms of background, we wanted to provide some context looking beyond genomic sequencing. So across many of the partner organizations that work in genomic sequencing, a lot of the partners have actually spent significant investment and time working in the molecular diagnostic space more broadly as well. And so, as the genomic sequencing space has been evolving, we've been wondering what is there that we can learn from the work that's already been done to make molecular diagnostics much more affordable, much more accessible, perform much better as part of a routine health system. So we wanted to share some lessons from the molecular diagnostic space today. And one of the key areas that we're focusing in on is around the improved SLAs that are established for viral load, for EID, for TB testing, all of these molecular diagnostics that have undergone so much change in recent years. One of the things that really has, from our perspective, enabled this change is a very high standard in terms of the service level agreements required from the suppliers of those devices. So what did this look like? One of the things that this did is establish 3 key principles for molecular diagnostic SLAs. The first is comprehensiveness, which really means making sure everything is covered that is needed. So it really doesn't leave the lab with unexpected costs very often. The second is transparency, so very clear expectations set in detailed contracts. And the third is around accountability, so actually being able to monitor the implementation of contracts and ensure that suppliers are accountable. So in terms of comprehensiveness, what this looks like for molecular diagnostics is really that all the possible costs for both the goods and the services are covered. So the suppliers have committed to all the installation support, paperwork, validation, all of the training and supporting documentation. In terms of preventive maintenance and corrective maintenance, everything is detailed there. It also includes, when it comes down to the spare parts, includes even the shipping costs, so that there's really no unexpected cost. Lab doesn't say we have a service maintenance contract, can you provide us this corrective maintenance? But then they have to pay for the spare part, or then they have to pay for the shipping of the spare part. It also includes labor and travel for the engineers. So you can see here, basically, the molecular diagnostics community has established what needs to be covered and made sure that it covers everything that's important to them. In terms of transparency, there's also some best practice to learn. The SLAs for molecular diagnostics have very detailed lists about which services will be conducted during preventive maintenance, how frequently those need to be conducted, on which schedule. It details the spare parts. For example, it also has various procedures for things like renewing the SLAs, who should cover the health checks if they're needed, processes for things like escalating the services if you're not getting the service that you need. Basically, the documents are really meant to answer any questions that a lab or supplier might have about what's covered and whose responsibility it is, so that there's no confusion when the time comes that there's a problem about who's responsible for what. And lastly, in terms of accountability, the contracts have key performance indicators that are monitored and reported on a regular basis to make sure that the labs and the suppliers are really understanding whether the contracts are being fulfilled and taking action if they're not being fulfilled. So on the next slide, you can see some of the examples from the PEPFAR SLA for molecular diagnostics about what's being monitored in terms of supplier performance on these contracts. And it includes the percentage of machines that are serviced to preventive maintenance. It includes the total uptime of the machines and many other key performance indicators, which have supported the uptime of these devices, supported the labs to manage their contracts with the suppliers and actually get the value that they've paid for from the SLAs. And really, they've contributed overall to the ability to utilize these devices much more for testing needs and greater, testing volumes overall, because labs are not dealing with extended downtimes from their devices and awaiting the services that they need. So with this background in mind, CHI, along with some partners, the Gates Foundation, supported of course by AfCDC and ASLM, has done some looking at genomic sequencing SLAs, and we wanted to share the results of those assessments with you all. So this is an example of one of the SLAs for a very common device across Africa, the Oxford Nanopore devices. You can see here, just a very quick first impression. The support terms can be quite short. There's not that much detail. It will say things like it excludes interventions required due to customer-caused damages, or it includes onboarding support, but it doesn't really detail exactly what's needed there. Similarly, this is a summary of the Illumina terms, and both companies provide some more documentation. But our very first impression when looking at this was that there seems to be some lack of clarity around what exactly is included in these, what's not included. And thinking back to the key principles from molecular diagnostics, the piece about transparency seemed to be missing. But that's just from assessing the terms on their face. We also wanted to find out from labs what their experience has been. So an assessment was conducted to really understand some of the gaps and recommendations from the lab level. So you can see here, basically just to summarize, this is feedback for the Illumina and the Oxford Nanopore. There's also feedback on some of the other companies. Some of the key challenges that are faced are long turnaround time after contacting the manufacturers. This is especially aggravated by difficulty contacting channel partners. There's also long turnaround for parts replacement because it's often stored so far away. The high costs and inconsistent pricing are a common complaint, and also unexpected costs. So you think you have a service and maintenance contract, but maybe something you need wasn't actually covered. So that's what we found on the ground. Thinking back to the key principles of inclusivity, transparency, and accountability, really there's room for improvement on all of these principles. So in terms of inclusivity, the labs are often paying for goods and services, even when an SLA is in place, because not everything that they need is included. So it's really not comprehensive, the terms of these agreements. In terms of transparency, some of the detail is missing to ensure that it's very clear who's responsible for providing what goods and services. In terms of accountability, there's no KPIs associated with these contracts, and performance is not routinely monitored. So this is part of the background why AfCDC has advanced required minimum serviceable agreement guidance. And I think, now is just the time for this community, this CoP, to be thinking about what an improved service level agreement meets the needs of genomic sequencing would look like. And on the next, I'll talk about some of the work that I is doing to try to support this shared goal. So, there's been guidance issued by AfCDC, which hopefully Dr. Sifonius will come back and have a chance to finish discussing with us. And in line with this guidance, as CHI, we're looking to develop a sort of template for SLAs for genomic sequencing, which will be in line with all guidance in terms of the required minimum services, but having it together in a template and negotiating that with suppliers and making sure labs have that template available to them, we feel will help to set a new standard in terms of what SLAs look like for genomic sequencing. So at the moment, we have adopted a template. This is based on the molecular diagnostics best practices and the assessment results, and of course, AfCDC guidance. Our plan now is to get input from experts and potential end users of these contracts. So hopefully even today, we can get some feedback from you all about the details of this draft template. And then our goal is to develop a subgroup within this community of practice who's very focused on advancing this SLA. Ideally, it's labs actually looking to implement this improved SLA template. And then, of course, we'll need to negotiate and socialize it with suppliers, and then work together to take between end users and suppliers of the improved template. So we have a very ambitious goal of seeing this done in the next few months. So we're really eager today to kick off the discussion with you all, but hopefully also have some of your participation in the subgroup. So especially the labs that are maybe going to be buying service contracts for SLAs this year. It will be very great to have your participation in the subgroup. So my colleague will share a survey at the end of this presentation, which will allow for you to provide feedback on some of the details of the draft template, as well as express your interest in being part of the CoP subgroup. So please be sure to find that survey in the chat box when actually maybe she can share it now. Fan, if you don't mind sharing the survey now, that would be great.
Yeah, just to post it on chat box. Thanks, Julia.
Perfect. Thank you so much. And so looking at the time, we have some slides here where we wanted to go through some of the details of the draft template. Nyasha, how much time do I have left? Should we continue for 5 more minutes?
Yeah, I can give it to you 5 minutes, okay?
Okay, great. So in terms of looking at the draft template, this is the part of the presentation where we're really hoping more for discussion and feedback. You can see here some of the areas that I've highlighted. Oh, and this one has a typo. Should be 24 hours. Okay. So we wanted your feedback on some of the details for the maintenance policy. The guidance is currently that suppliers should provide remote support within 24 hours of a problem being reported. They should provide an engineer within 48 hours in urban areas and 120 hours in rural areas. They also should cover all of the costs related to labor, shipping, clearance, travel, and replacement parts. There's a language here around expecting 2 corrective maintenance visits per year that should be covered. So in case there's more than 2 corrective maintenance visits, it would be at the cost of the end user rather than the supplier. And there's also language here to stipulate if you're going to have to pay, maybe you need 3 corrective maintenance visits, how much should you pay for the additional visit? And we're hoping to set a standard flat fee. So my question, and in the survey that we're putting, I'd love to hear feedback from the group today. How many corrective maintenance visits do you think should be covered in the template service level agreement? Based on your experience, you know, if you're always needing 3 visits for corrective maintenance, then we should ensure that 3 visits are covered. If you're only having 1 or 2 visits, then maybe 2 visits is sufficient to have covered in the SLA. But we need your feedback as end users today to determine what's the appropriate number of corrective maintenance visits. So please, if anyone wants to jump in with their experience, maybe anyone who feels very strongly that this number should be higher or should be lower, please jump in or share your feedback in the chat, and definitely be sure to share your feedback in the survey as well. And I can't see the chat, so maybe Fan, if you can see it, please feel free to help facilitate.
Yes, just if everyone, you can please click the link I just shared on chat box and provide the feedback about maintenance policy. That would be great.
Perfect. And I'm seeing here one very important question about to what extent would the vendors agree with the terms outlined here? It's a very good question. So far, initial engagement with the vendors has been positive. They are open to feedback from their end users about the terms that are needed. Of course, if we can work together to establish a new standard, it will be more powerful than individual labs trying to negotiate for these improved terms. I think that's part of why we want to engage this very strong community of PROC today, is to make sure that we're doing this as a group to be able to better negotiate for what's needed. But I do think initial engagements, the vendors have had open ears for our feedback and wanted to understand what an improved service contract could look like. So it's worthwhile to pursue these discussions together. And maybe just jumping to the next slide, one of the other areas of the template that we really want user feedback is around the spare part policy. So from your perspective, from your experience, do you have any feedback on which spare parts should be covered by the contract? These might be parts that are, need to be frequently replaced. So should be covered by the contract that the end user pays additional costs when replacement is needed. Similarly, if you have any experience from spare parts that you think should not be covered by the contracts, please let us know. And then finally, we're interested if any of the spare parts need to be stored within your country to reduce the turnaround time when a problem arises. Maybe you've had an experience in the past where a very critical spare part is missing and it takes too long for you to get it into the country. And so you're unable to use your equipment for a long period of time. Please share your feedback in the survey or come in even now with your experience so that we can make sure this feedback is part of the templates contract. May, if I see your hand is up, please jump in. May is muted. Is one of the facilitators able to unmute her?
Maybe if possible, maybe for the meantime, you.
Okay, yeah, I got it. Thanks. So Julia, just on the points that you've made about spare parts and also looking at a comment that I think Doris made regarding ONT and Illumina. So, I mean, standardization is very good and it's important, and that's one of the tracks that has been discussed, for the last few months and at the last workshop and that. But obviously, the service agreements for ONT versus for Illumina are different because of the equipment itself. With different types of services required for ONT that I believe are more software-based as opposed to hardware-based. And then when it comes to spare parts are obviously going to be different by equipment, by, machine. And I think also given that we're going to see new equipment coming on board, I think I'm trying to understand how the standardized templates can be effective without being rooted in older equipment or in, trying to be too general to cover all equipment versus being specific. So how are you thinking about addressing the potential changes as they go forward and addressing the differences between the different equipment manufacturers? Over.
Yeah, it's a great question, Meg. I think to start, it's very important to treat the different, unlike other areas, the technology behind some of these different sequencing equipments is fundamentally different. So I think, AfCDC's guidance can be seen as general best practice. I think the next layer is to come up with sort of a template that's more equipment specific. And that probably, differentiates between the different companies. So having a template for Illumina and a template for Oxford Nanopore. And for now, we can learn from historical equipment, but absolutely going forward, these will need to evolve. And the truth is, these companies are developing contracts, they're developing terms for new equipment every time it becomes available. So, I think just making sure that we have, we're part of those conversations, that the experiences from the old equipment is being brought forward, of course, recognizing that there will need to be evolution. So starting with having principles at an AfCDC level, and then having some standardization across at least the most common equipments at the more detailed template contract level, and then making sure that we're engaged as new equipments become available, so the different perspectives are captured, and some things may be unfamiliar territory, but we can certainly learn from the past as well. But that's how I am seeing this.
Okay,
Thank
so
you.
maybe two quick suggestions. So one is that maybe an inclusion on a continuous improvement clause in the SLA, so that basically if there is continuous issues on a piece of equipment seen across multiple countries, that the manufacturer's got the responsibility to go back and look at whether it's a mechanical fault, software fault, or whether it is user training or whatever. But then the second thing is that maybe there's language such as, the top 3 faults. So rather than calling out the exact faults, but if there is a trend of particular faults that are happening, that then there's a requirement that the manufacturer ensures that the spare parts for that are available. So that requires the ongoing monitoring, and things may change as equipment becomes older. So just a couple of suggestions.
Absolutely. Great suggestions. Thank you.
Thank you very much, Mayor. Thank you very much. So without much further ado, we are going to delve into the questions. We're checking and recording the questions. We are already at number 18. We will make an effort for the presenters to share the questions to the presenters. They will prepare answers and share to you on the same email blast that we used for the announcement of this meeting. Meanwhile, we are going to have a few questions run through, questions posed to the presenters. As I'm going to pick a few of the questions, I will combine 2 for a start, Julie, 2 or 3, and see if this is Julie or Sophonias answering this. The first one is that the HIV and viral loads SLAs have been very effective, but due to the global donors change in the funding landscape, what is the recommendation? Is it a lift and shift for the SLAs from being managed by the partners to the ministries of health? And the second one is what is the role of vendors in the standardized SLA template that you have proposed? And also, this was Augustino. And also, we have got the last part where it says here from David Ocheng, what will be the role of vendor-managed inventory in the service level agreement for genomic sequencing in Africa? Over to you, Julie. And if you want Dr. Sophonias to chip in, you can also ask over him.
Sure, and Dr. Sophonias, please, I'm sure you'll have thoughts on all these questions as well. From my perspective, the HIV and viral load SLAs have been obviously initiated by the donor community. There's been efforts to shift the management of these contracts to countries. And my, a silver lining from all of the turmoil that's happening right now would be if countries are really able to take ownership of managing these contracts. Hopefully, the result of this turmoil is not that these contracts cease to become the standard, but instead that they become part of ministries of health capacity and become actually more broadly used and applied to other areas beyond viral load, just like genomic sequencing, which of course would be more managed by labs and ministries themselves. So our goal is to see these tools taken and applied more broadly rather than being isolated in the donor-supported product areas. In terms of the role of the vendors, it's absolutely critical that vendors will have to buy into these standard SLAs. As I mentioned, I think there is some recognition of the difficulties and the impact that having poor SLA performance has had. Vendors want their equipment being used. It enables them to sell more reagents. It also is just part of building demand for the services that they offer. So I think there's some interest from the vendors in the principle of having a model that works better in terms of service and maintenance for Africa, but we'll have to have negotiation on the details with them. And it's best to do that together as a community of practice. And it's helpful to have, the policy recommendations of AfCDC and all of these ingredients that we're starting to pull together in order to make those negotiations effective. In terms of vendor managed inventory, how we see the space is that there is a lot of space for innovation, and perhaps the way to move is in a stepwise process. So first, making sure that the vendors are able to support service and maintenance and do that effectively, respond to KPIs around the service and maintenance contracts. And eventually one of the KPIs could be a complete vendor managed inventory procedure. And that could be a future step. I think there may be some demand, but whether or not that's feasible right now is a question. So the more steps we take in that direction, I think the more we can have that discussion about vendor managed inventory. But it certainly could be an interesting way to go.
Thank you very much. The second question and the last one that we are going to deal with is directed to Dr. Sophonias. This is from Shabani, who says that countries like Tanzania have employed on-site biomedical engineers to take care of equipment. Can we think of capacitating these to conduct preventive maintenance at a lower cost? Can AfCDC and other authorities explore this? Over to you, Dr. Sophonias, briefly.
Thank you very much. This is actually one really good question and one more sustainable approach to bring the maintenance closer to the users, to the countries. AfCDC is currently exploring. In some cases, we are supporting capacity building for maintenance, capacity to be built in some of the sequencing hubs. This is something that we started this year. We are also in discussion with the private sectors to establish training centers at AfCDC reference laboratory to support this kind of areas, skill sets that are lacking at the moment in Africa. So this is an area that we are taking very seriously, and we think this is one of the sustainable solutions to address the gaps when it comes to having skilled engineers that can install and maintain and repair some of the sequencing equipments. Over.
Thank you very much, Doctor. As promised, the answers to the rest of the questions will be shared via email. May I please take this time to acknowledge the presence of the Chief Executive Officer of Africa Society for Laboratory Medicine, Mr. Ngobi Ndlovu, who is in the house. And this time, sir, may we hear your thoughts on this subject. Over to you, sir.
Good afternoon and good morning, colleagues. So it's my pleasure to join this session. So just a few things. I know we are coming to the end of the session, but just to start by congratulating this community of practice really for your participation and your commitment. We know we can only address these issues when we come together as a continent because our experiences as a continent are unique, and we also do have solutions when we come together and we discuss them. Something that struck me as I was listening through the session today is the summary that Sophonius gave to say that the current service level agreements that we have in many countries are too expensive and they are not working. So I think the message is very clear to us here as a community that we need to begin to pull together, especially as we realize the increasing role, the importance, and the powerful role of genomics that it's playing in our public health, and of course, even the research laboratories. So that is a call that we need to come together. So as a community and also as ASLM, really, we want to encourage that we use this platform really to shape and to recommend, how these service level agreements should look like and how they should actually help the country so that we are not experiencing any high cost, any disruptions in testing. So I'm looking forward to, I think, having really practical solutions coming out of this, coming together as a community. And also, I really want to appreciate the role of our partners, Chai, that has been leading this initiative. Really want to appreciate that. And of course, all of us working under the leadership of AfCDC, we really want to also recognize that. So I'm really looking forward to the survey in terms of, what our experiences are, and I'm encouraging all the member states, really let's participate so that we can collectively shape how these several level agreements should look like, taking into consideration our pain points, the things that are very important to us. So I really want to, I think, end by appreciating, these conversations and discussions, and we are happy to be supporting and bringing you the right discussions and also the right facilities that will be speaking to these issues. So thank you so much, and over and back to you, Nyasha.
Thank you very much, Mr. Ndlovu. SLM, thank you very much, AfCDC, for your presence and all the leadership from the Gates Foundation. We really appreciate this discussion, and as a committee, we are also going to consider probably having a session 2 by public demand, as the many questions that we received here from the over 250 people that were present today are very touching and very relevant, and this shows that they are really coming from the ground where the things are happening. We really appreciate your participation today, and after consultation with the group members, we are going to come back to you not only with the suggested answers, but probably with a follow-up session to discuss the operationalization of this very important topic. Once again, I would like to appreciate your presence today, and I wish you the rest a good stay the rest of your day wherever you are. Thank you very much, ladies and gentlemen.
Thank you.